Hi.
Hello, all you constipated people out there. Welcome to Knock Knock Hi with the Glockenfleckens. I am Dr. Glockenflecken, also known as Will Flannery.
I'm Lady Glockenflecken, also known as Kristen Flannery, and I apologize for my husband.
Neither of us, at the time of this recording, are constipated.
That's true.
We are flowing. We are our healthy bowel movements. Wouldn't say the same for our diet, but, you take what you can get. Anyway, we're talking...
I don't know what you mean. I just had a nice hefty handful of goldfish crackers.
Oh, God, I didn't know where you were going with that. I was going to say nice, hefty something else, but I'm glad it went to goldfish crackers. We are talking with Dr. Paul Tran, a pediatric gastroenterologist and also magnificent content creator.
Yes.
He is one of the shining examples of how to do medical comedy correctly.
That is true.
And say, not that there's one way to do comedy, but when I say correctly, I mean like ethically.
Yes.
Smartly.
As a healthcare professional.
This is kind of how you do it. If you want to be funny on social media and also be safe and hilarious, like take a look at this guy. All right, he's good. He's really good. So check out him on TikTok, and then you can walk away for a bit, go watch some of his TikToks, and come back and listen to our conversation. We talk about content creation, talk about constipation, and I think it's better that we focused on that part of gastroenterology versus like other things that can happen with gastroenterology.
I don't even know what those could be. Maybe that's for the best.
You have no idea what else can happen? The opposite of constipation? Does that
Oh, okay. I see where you're going. I was thinking of like, serious disease things.
Sure. Yeah, that too.
Yeah.
But anyway, we had a great conversation with him. So why don't we just jump into it, shall we?
Let's do it.
All right, here we go. Dr. Paul Tran. Hey, Kristen.
Yeah.
Be honest. Do people think about their eyelids?
Honestly, I don't, unless something's wrong.
They should, because eyelids are amazing. They distribute your tears. They protect you from incoming objects. They're really important for overall eye health as well.
And we both know they can also be affected by something very common, Demodex mite.
Oh, yeah. Demodex blepharitis.
That's
when
right.
Demodex mites overgrow and they start causing problems like itchy, red, irritated eyelids with crusties.
Mm-hmm.
Collarettes, you got it. And everyone should know that if your eyelids aren't healthy, your eyes won't be either. That's why it's important to see an eye doctor, to get an eyelid check, which is part of a normal eye exam.
And the good news is there's a prescription eye drop treatment available for Demodex blepharitis.
It's great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, we are here with Dr. Paul Tran. Paul, it's about time we got you on this podcast.
It is so exciting to meet you both, and it has been a long time coming. I've been anticipating this pretty much all of my career.
Well, that's a good place to start. Where are you in your career? You're a pediatric gastroenterologist, so you've presumably already completed all like 12 years of your fellowship training and residency, and I don't know how many crazy amount of years you have to go, but yeah, you're done with all that, right? You're like in practice.
That's right. I've been in practice now, actually going on my 4th year. So even though I play a medical student on socials, I did my 3 years of residency already, 3 years of fellowship. It's not quite 12, but it seems like it when you're agonizing over like how long you actually have to do this research.
Yeah, and I've I'm a self-described, like I fully accept that I am a bit of like a medical comedy snob. Would you say?
Oh yeah.
Like
yeah.
I'm like I've got high standards.
You are hard to please.
And take that as, I mean, I'm willing to accept criticism for that, but I will say, like, Paul, your content, it makes me laugh consistently. Like
that's the highest compliment he gives.
You do such a good med student impression. It's uncanny. So people like go and check out Paul's like TikToks and just look at it, because like it almost like just makes me anxious. Like it makes me laugh, but I'm also like, God, man, like I'm actually looking at a med student like trying to exist in an exam room and not sure where he has to, what should he open a door? Should he sit down? It's like, I'm just so impressed by that.
Man, I wish my mom could hear that again and again and again and again. On a serious note, you do not know what that means to me. It means that means the world to me. Truly, to hear you say that, someone who's really inspired me to get into the sketch comedy, and then someone who's a mutual and a creator, very well. But Preston is someone who also inspired me to get into really depicting what it's like as a student. So, man, that means the world to me, and I'm just channeling my inner trauma, man.
Well,
yeah, that's right.
Well, what I like about what Preston does and you is you're better at playing with others than I am, because you actually have a camera person like helping you with this. So like who's behind the camera for you? Do you just make your med students like do like uncompensated work for you to help you create content? Is that what's happening here?
Let's just say there's a very underlined, highlighted, and italicized sentence in their letter of recommendation that says they work really hard, they aim to please. It's
strong work.
It's not unearned.
Too funny. Well, you and Preston are the only two people that I have ever heard you say out loud.
Yeah.
That you not only approve but enjoy their comedy.
I do. But my one question I have just in watching your recent content, Paul, is as you get into your career, how long do you think you'll be able to realistically pull off being a med student? Because that's a problem as I get grayer.
But see, he still has access to med students. Sounds like.
No, sure. I'm talking just physically. Like we all age at some point, and not to say like people in their 30s and 40s can't be a med student because there's plenty of them. But it just gets it will eventually, Paul, get to a point where people are like little old, I don't know. Like it's not. I don't know. Not quite. I'm not quite buying it.
When I get to the med student emeritus stage, you're talking about.
That's right. Yeah, exactly.
The good news is you can always play a fellow.
Yeah, that's true.
It's true. There's so many levels of training. And to be honest, I'm banking on the Vietnamese genes holding me, and then maybe the Korean skincare holding me just long enough that people are like, okay, he's not sighing before sentences. He's not like, oh.
Yeah. Okay. When you get up.
I would love to know because you're in the field of pediatrics, like how do your fellow pediatricians, what feedback have you got within your field? Because like for me in ophthalmology, like, the ophthalmologists, I think they're okay with what I do, but I feel like it took a while like for them to embrace me, but I don't know. It seems like the pediatricians maybe would be more open to it.
I got to tell you this, especially because you were the keynote speaker at the American Academy of Pediatrics. But I was virtually unrecognized by pediatricians, and very much very much celebrated by every medical student and trainee there. But like pediatricians would walk past with their pediatrician unicorn headband on and just stream in, of course, to see your speech. And I was like, this is really amazing to get, to be in the same even breath sometimes as other creators who have inspired me. So I would say TBD in terms of pediatrician acclaim.
You're in a good specialty, honestly, for doing medical comedy. And I just recently on this podcast just talked about what I'm calling a comedy ladder, a medical comedy ladder, which is within the medical field, within the different specialties. It seems like there are certain specialties that it's safer to make fun of, like from my standpoint and my comedy, and certain specialties that's just a little bit more challenging. And I think there's different factors for this, and one of them is the ego. Like we can all make fun of neurosurgeons. Like it's fine. Like that's just say whatever you want. Like they're going to be okay with it. They're like, They're like top of the ladder, right? And then, but also a big part of it is the amount of respect. And the reason when I put this ladder together, I put pediatricians like near the bottom, because I think that there's a lot of a lack of respect.
You need to say what the bottom means.
Oh, the bottom doesn't mean like you're not. It has nothing to do with your ability as a physician. This is all about kind of, if you're gonna poke fun at a specialty, like who would be more accepting of ridicule within the medical field? And I think
it's based on like punching up and punching
it's
down.
kind of like punching
right?
up and punching down.
You
And
never punch down.
a lot of it has to do with like who, how much respect that specialty gets from the government, from just society, from patients, from other members of the community. And there are certain specialties that are kind of punched at a little bit more from a respect standpoint. And I'd say like family medicine, pediatrics, primary care is one of is a group of those specialists that kind of are taken advantage of a little bit more. And so I guess what I'm saying is, as a pediatrician, would you agree with that assessment? And also, do you feel like you could just go after anybody? Because I think you can. I think you can really like let people have it. It's great.
I almost want to call your ladder fodderability. Like, is there fodder to make fun of, the Glockenflecken fodderability scale?
Yes.
I need to workshop the name of it. But yeah, you get what I'm saying though.
Yeah. No, I definitely do. I think, sure, is there ability to punch up? Yeah, I think universally people would be accepting of a pediatrician, saying, "Hey, I want my place here. I have a voice. I'm advocating for patients and our field." I think it's acceptable, but I 100% agree with what you mean. Man, just from a medical student standpoint, like on a serious note, you know what the number one response to that my mentees get when they're like, "Oh, we're going to go into pediatrics"? It's, "Oh," like, "Oh," or, "Wow, I could never do that," or, "Oh, I thought you were more competitive." And I'm like, "What?" Doesn't have to do. It has nothing to do with competitiveness. It's, where do you feel your impact could be? Where do you feel like you can make a difference? And that makes me sad. When people look down with like, it's something you accepted instead of eagerly embraced.
I feel like that's part of what people call like the hidden curriculum of med school, right? It's these biases that people have. In fact, I made a video like a few years back about people viewing like pediatrics as like the easy specialty, right? Like, why? Like, don't you want to do something like more challenging? Like surgery, or it's that kind of thinking. This bias, and within the medical field itself, that I feel like making content, like the way you make content, I make, there's a lot of pediatricians, great pediatricians making great content, but I feel like social media is a really a great way to try to break down and get rid of that type of thinking.
I 100% agree, because you can't solve a problem if you don't know it exists. To what extent it's pervasive. You don't really know the problem if you don't know who it's affecting or how it's affecting someone, or even if it affects you. If you're a stakeholder without knowing it. And especially sketch comedy, skits, humor in particular, I think it's a really nice way to put it in a socially acceptable format that people are like, "I'm entertained. You've made me think now. And wow, maybe I should do something about this at the same time."
Yeah, it's a great way to trick people into what we always talk about, people into learning things about medicine,
and themselves.
That's right, exactly. So are you at this point, because it's been a while, I find that the further I get from med school, like the harder it is for me to make content like about like getting into that headspace. But it seems like you work with med students, right? You're in an academic center, and
almost every single day of my job, I have someone with me, whether it's a pre-med shadowing, a medical student, a resident, a fellow. I work in a kind of hybrid system. I'm actually a pediatric clerkship director at one school. I'm a pediatric specialty advisor at another school. I mean, I live and breathe education um, every single day of my job professionally, let alone my platform. So I've got a very, very good finger on the pulse, I think, of what the experience is like right now.
That makes a lot of sense, knowing your content.
Yeah.
And then my follow-up question to that is, how often does a med student follow you into the bathroom?
Not as much as you think now, because I've learned the preservation, like the shame
They might be there.
preservation,
Yeah.
where I'm like, 60 seconds, you don't need to know. I'll be back.
Yeah.
Yeah.
You can preempt those types of lemming characteristics that med students have for their attendings. Do you have to, when you have a new med student come on to your service? And I'm asking these questions because I'm curious, but also I don't have any trainees like with me, and so I don't. In a way, I'm kind of jealous of you because you have like a direct access to like an endless treasure trove of content that you can just draw
ideas.
from.
Yeah.
Is the interactions, right, with the med students and the trainees. And so, but when a new like student or trainee comes on the server, do you have to like reassure them, I'm not going to mine you specifically for content. I don't want you to worry. Don't let that stress you out.
I actually don't have to do it very often, but there's one interaction that it was one of those awkward handshake things where someone I knew very well thought I was introducing myself again and stood up to shake my hand, and I was like giving a high five, and it was kind of the hand meets high five, and they just called themselves out. I was like, oh wow, that was very embarrassing.
That's a classic fodder. That's high fodder ability right there for content.
That's right.
I have a question along those lines. Like, you might have med students, or, anytime, especially when there's somebody new coming in who might be wondering, like, if I make some kind of a mistake, is that going to end up in a video down the road, right? So, like, where are your kind of ethical boundaries around, like, what kind of content you create, especially given that you do work with, medical students and trainees so much?
Thank you for that question. Truly, it's one of the questions that I think is unspoken by students, by people watching my content who don't know the creative process very much. You've said before, well, don't punch down. You said it earlier in our conversation, and I think about that very much. When people say, "Oh, you're the guy who makes fun of medical students," I immediately correct, and I'm like, "Never. I would never ever make fun of a medical student. I would never ever make fun or even get close to talking about something clinical that makes fun of a patient. Never. I make fun of the circumstances they go through. I make fun of the awkwardness of the situation. I make fun of things that people can relate to. Never the person. Never ever the person." So I try to make it very clear right up front. If someone's anxious, which is generally not the case, I think I'm approachable enough and I have enough reputation amongst my peers and colleagues that usually people are looking forward to at least hearing what I have to say and working with me. But I try to make it casual, and I say, "Hey, look, I'm not here to make content. I'm not an influencer vlogging my day. I'm
Yeah.
here to teach. I'm here to help you learn. I'm here to take care of patients.
Yeah.
And then if we have time later, if you have ideas for content, let's talk about it." People usually love doing that, but I make a very clear delineation of, hey, this is work, this is learning time, and this is fun, creative time.
Oh,
Yeah.
that's so smart. That's absolutely, because you can totally see how the lines get blurred, when you're a practicing physician and a content creator. And that's such a valuable lesson to teach, med students and trainees who have grown up. All they know is that there there are 100 different medical influencers, and this is a thing you can do to make money and gain, dopamine hits whenever you get a bunch of views, and to show them like what it looks like to actually take a career in medicine seriously, but also have this creative outlet to be able to use for yourself, for your patients, for society. I think that's so smart, and you really hit the nail on the head about what it is that you're actually doing, and it's subtle. It's whenever you do it right, it's subtle, but it's also in a way kind of just obvious. Like when you're watching you as the med student, never once do you think, "Oh, this guy is disparaging med students. This guy is making fun of med students," because that's really not. It's not what you're doing.
If anything, you're like super relatable. Like he was saying, you make people feel what the med student is feeling.
Right, and it's focusing on the circumstance and the situation that's really the direction that your quote unquote ridicule or the comedy, the punchline is directed toward, and that people may not be able to like put into words what exactly they're seeing, but you can tell just by being an observer of the comedy, it's coming across that way, right?
Do you ever, I mean, I know you're super involved in education, so do you ever go into classes or put into a curriculum or something, like guidelines for students who might be making content as they're in their medical education and training?
Yeah, that's a good question. I have given lectures and talks on it here and there, different our Pediatric GI Society, I've done a grand rounds on it. I'm actually, as part of my role for the fourth year advisors, I'm going to be doing a kind of professional development day for fourth year medical students who are matched, and then actually opening it up to residents and fellows too. But the things that we never learn ever professionally that most of our peers are learning at 21, 22, right out of college. Things like how to create a LinkedIn profile, how to send a professional email with what you need at the top, how to approach asking for mentorship, how to approach networking. Hey, these are things like you stumble along and try to pick up here and there and then realize, oh, wow, I should have done this a long time ago. I'm going to try to put it into at least a session, but I haven't put it in as part of a formal curriculum, and I think we need to.
Yeah, we definitely need to. But if we did more of that, what you're talking about, Paul, then how would we have time to learn how to write a prescription for a medication like by hand? Like I mean, or like the mechanics of sending a fax. Paul, I don't know if we can fit all of this into the 4 years of medical curriculum. That's all I'm saying.
You're going to have to be tending to your leech farm at some point. And between tending to the leeches, between aspirating certain humors, you're going to have to find time to develop as a professional.
Don't forget the trepanation. It's got to happen too.
Yes. It's an important part, but we do need I think more formal curriculum around.
Yeah, it's like not only time,
social media
it's
ethics.
pastime.
Yeah, we've been talking about it a lot recently just because there's so many people making content and it's just like the Wild West out there.
Yeah.
It kind of feels like that sometimes, and so let's put some guidelines out there for people. Chris and I were talking about this earlier today. Doctors, we love ourselves a good set of guidelines, don't we, Paul?
Oh, let's do it. We just need a really well-constructed acronym that uses the last two letters of a word to force in an acronym that barely makes sense.
We got to get the cardiologists on this.
Well,
they're really good at that.
I have an acronym for we have kind of 5 things that we think about. I'm going to regret this because now I'm going to have to pull them off the top of my head. But
should we take a break before you do this?
Oh, sure. Yeah, because then I can go look it up.
Let's take a break and we'll come back with Kristen's acronym.
Okay.
Which I'm sure is going to be unbelievable. All right.
It is.
I love it.
All right, we're back with Paul Tran. Paul, we're just about, are you, we had to take a tiny break because Kristen really wanted to unveil this acronym for us about.
How often are we just casually in conversation talking about this where I can say, you know what I have?
Okay, so this is an acronym for social media ethics.
Yes.
Okay.
That is right.
Good.
This is based on our own ethical guidelines for social media as a medical professional.
So so we'll do this quickly, and then Paul is going to help us make it sound actually fun to learn.
Oh, I'm ready.
I have it as Tdap C, like -C.
So
right?
Tdap like the vaccine.
Correct.
Plus a C.
Plus a C. That is not really part of the vaccine, but it like is a good mnemonic because it makes you think of.
Oh, what are the 5 things?
Okay, so T, truth. Be accurate and evidence-based.
Good tip. Yeah.
D, disclose. Name your conflicts of interest and financial disclosures and all of that stuff. A, advice. Do not give individual medical advice. P is for punch. Do not punch down, as we've already talked about. And C is confidentiality. Protect patient privacy always. So that's a very quick and dirty framework that we use to kind of guide, your content. This came from you.
I think the A could be, we could replace advice with always be making fun of surgeons.
Or making fun of surgeons approved. There's just universal approval.
Oh, yes. Approved. Yeah.
Oh, it's approval. Yeah. Approval.
Very good.
Yeah. No, that's good. It's Tdap. I think Paul, you had changing those around a little bit.
Yeah, because you guys love your acronyms and your mnemonics. So, feel free to workshop.
I just said it as a saying, a nice little catchy soundbite, especially skit-worthy soundbite. CT, the PDA.
CT. CT.
You get a CT for...
Sure.
We get CTs for less.
That's true. And CT for in the PDA, patent.
Public display of affection is where my mind went.
Oh,
I was like, how do you CT that?
No, patent ductus arteriosus.
Oh, there's a medical. Okay.
That's right.
There you go. Well, that works better for you guys.
I wish I could say that I remembered those letters, but I just heard Paul say it offline before we started recording. So I do have to give him credit for keeping me current. All right. Hey, can we change gears to talk about gastroenterology in kids?
I have a gut feeling I can tell you all about this.
I have a gut feeling. I appreciate your pun.
Okay, first, I do like elementary school. That's very good. It's so good. It's so I guess go ahead and tell us about elementary school.
Well,
and what I think a lot of people actually are not going to know what elementary, what is that? Like this one over here. It's like what?
I had
no idea.
Oh, when people are like, "Oh, I want to follow you," how do you spell it? And I spell it out, and they're like, "Don't you mean ELE?" I'm like, "Well, it's part of the pun."
No, kind of.
The alimentary tract is the digestive tract. Alimentation is the act of eating. So alimentary, digestive, because I'm a gastroenterologist and I'm interested in education. So I wanted some pun off of education. I was like, oh, elementary school teacher, elementary teacher, kind of workshopping. And I was like, oh, elementary school is just,
I love it.
Comes off the tongue.
Mm-hmm. Are there any specific things in pediatric gastroenterology, like any things that kids consume that just wreaks havoc on their GI system?
Oh, I mean, we got hot Cheetos and Takis right off the bat.
Oh, tell me about them.
Spicy.
So they don't necessarily cause ulcers. They increase gastric acid production that exacerbates symptoms of gastritis or ulcer disease. And the interesting thing is there's this actual entity called flaming hot Cheetosis. It's maybe an ICD-10 code for that.
Oh my gosh.
It's where you're eating flaming hot Cheetos or Takis and your poop turns red.
Oh.
And
that's
parents would it's freakish, right? It's not normal. And here's the thing, it's not blood. Even though you have symptoms of your stomach hurting, it's not blood. It's the red dye that's in the actual coating. It doesn't get absorbed, so it comes out in poop. It looks really red, but it looks like blood, especially with digestive symptoms. So flaming hot Cheetosis, not necessarily blood.
Yeah.
Otherwise known as FHC. Can we assign that a acronym? Is that okay?
Not only can we
I
assign
feel like
an
that's one
acronym,
where it benefits from the full name.
it's true. I think that's one of those diagnoses that you just want to proudly say, I figured it out. This is what's going on.
Give us some other, how about this? Like, what set you on the path to you just loved intussusception, or like, what's the deal? What sent you on this path to GI, pediatric GI?
Yeah, one day I was like, dude, I just want a crappy job. I feel like I'm.
How come you laugh at his puns and not mine?
I just like at some point, I'm sure Paul was just like, I can't stop thinking of telescoping colons, and and I this is it for me. I don't know.
I heard someone say, choose a field based on the secretions you can handle, and I was like, oh, you know what? Yeah, poop and puke, it's pretty gross, but there's nothing to me like the sound and vision or visual of respiratory secretions, like that gurgling, like, I'm like, ugh. Could not do palm, could not do, that sound with anesthesia as you're suctioning. So, it's a secretion I can handle, at least multiple types of secretions I can handle. And, I like doing and thinking. It's one of those, gastroenterology is one of those dual procedure and clinical reasoning specialties that most people don't really want to go one way or the other. I'm not quite just a operative surgeon. I'm not quite just a clinician medical person. GI, maybe ENT, anesthesia, OB, these are some fields that are in the middle, and I think it's kind of cool to wear different hats on different days of the week.
We've had an adult gastroenterologist
Yes.
As a guest on this podcast, and I was very embarrassed because I just assumed there was a lot of poop involved in their job, and he actually told me no. Actually, the point is that there's like not that much poop, so we can actually see what we're doing. And so, on a scale from 1 to your family has explosive diarrhea. You're going through a norovirus outbreak. How much poop is there actually in your job?
My scale is a little bit different. On a scale of clean diaper to Taco Bell binger, at 2:00 in the morning,
Flaming hot Cheeto-itis or whatever.
with flaming hot Cheetosis on the side. Our job in pediatrics actually quite a bit more poop than on the adult side, because bread and butter, constipation, and encoparesis or soiling of underwear, essentially, that is one of the most common things that we see. So much so that I would say, 40-50% of visits in a day outpatient could just be constipation. It's that common.
Whoa.
And honestly, that's one of the things that drew me to the field, because of how satisfying it is to help families with it.
Yeah.
We can actually attest to that.
We can. We should not name
with one of our children. That's
which
okay.
one.
That's all right. But it's a huge problem.
Yeah.
That is, it like disrupts life. And
it can get that way. Yeah.
It can I totally I can understand why you would say that. And just from being on the patient side of things. And so I could see, we never got to the point where we needed to see a pediatric gastroenterologist, but I can understand how patients and families would love you.
Oh yeah.
For helping them poop.
Yeah.
It's
something you take for granted until you can no longer do it.
Yeah.
No, exactly right. Like, you're like, eating and pooping, they're just normal parts of being human. Like, come on, you should know how to do this. And it's a big problem sometimes.
Why is it such a big problem? Like, for kids particularly, is it that they're just eating a bunch of
Yeah,
crap or
yeah, what are,
no
like, the
pun
top
intended on that one.
like, what are
But
the top 1 or 2 things
like,
that's
why is it a
leading to
bigger
this?
problem in kids than adults?
It's an amazing question. This is really what we talk about day in, day out. And you're about to see how much I freaking love poop. Like, you're about to see my face light up when I talk about this. It's
I can attest for those of you who are listening on audio, he is smiling ear to ear.
Glowing, I would say.
Yes, just I'm ready to jump into it, and so
Let's hear it.
I think he's got a bucket of water next. He's going to hose himself off later because he's just so excited about this. All right, go ahead.
I have not been in the conversation until this very moment. I've just been peripherally involved. It's PTSD. It's because kids are very impressionable. And what I tell families all the time is we've all had that poop. We've all had that hard poop that's like, oh gosh, I'm not having enough fiber. I need to drink more. And, as adults, we're like, all right, we'll do something about it. But when you're a child, especially a young child, you have that hard stool. It comes out. It might tear. It just hurts so bad. And it's like touching a hot stove. Oh, gosh, I never want to do that again. And then they hold it in. And what happens is when you get the reflex to stool, you can choose when to go or not. That's different than peeing. Peeing, any long car ride, you can't hold it in for very long. But stool, you can hold it in. And over time, it just accumulates. And then what happens is kids will do this stool withholding behavior. I see it all the time. It's like, you might have seen it in, your kids. I saw it in mine, where kids will look like they're hiding, right? They'll suddenly go quiet and they'll hide. Or they'll stand with their legs straight, holding onto a table or behind the couch or behind curtains. And parents all the time will say, oh yeah, they keep doing that and they look like they're grunting. They look like they're trying to poop. And you know what I say in clinic or to families is, mostly to parents, I say, hey, wild college parties aside, when's the last time you pooped standing up?
It's a good line.
It never fails to get a chuckle. But people are like, no, I've never done that. And I'm like, exactly. Anatomically, you can't stand up and go. What they're doing is they're squeezing their legs tight together because they don't want it to come out, because they're afraid of the trauma. So when I go through this process and I'm like, oh, when you see that, that's a time to put them on the toilet. And I talk about what encopresis or soiling is, and it's not a hygiene issue. It's because they're losing sensation. And I go through all this. I feel like I can equip parents with this sense of confidence after, not this sense of like hopelessness and or despair, but wait a minute, you're saying I could get this fixed in a couple weeks to a month and I don't have to take off work to go pick up my kid from daycare or school multiple times a week? It changes people's lives with just a little bit of counseling, some education, and a little bit of laxative. I mean, it's insane. And that is why I love poop.
What are the big diet things that you're talking about day in, day out? You said, because we all have those things that we're telling almost every patient that comes in, right? I have them in ophthalmology. It's, don't sleep in your contacts, don't use Visine, and
Put a hot compress on
put a
it.
hot compress on it. See, Kristen knows. She knows exactly what I do every day. But so I'm curious what some of those things are for you with regard to food.
I try to make it simple as possible. One of the simplest things that we say that is the hardest to do is to eat not more fiber, but enough fiber. It is incredibly difficult to get enough fiber. As someone who just did an audit of my own diet, it is really, really hard to get enough fiber in your diet without using supplements, psyllium husk. It's just really hard to get enough fruits and vegetables into your routine to get enough fiber. But fiber is something that's very simple. You just get enough fiber and you're good. Very, very hard to do.
How close were you on your audit?
I'm going to be honest. I was on a day-to-day basis, a third to half of my dietary recommendation.
Dr. Tran. Dr. Tran.
You're one to talk. How much fiber are you getting?
You know what? I'm probably getting enough. Let's not talk about it. It's fine. I mean, it probably. I never even thought of the idea of doing like a fiber fiber audit. That would be an alternative good name for your website, fiberaudit.com. All right. Increasing, I guess I should eat more oatmeal. How about oatmeal? It's a good one.
Yeah. I like to drink my fiber.
What is your drinkable fiber of choice?
This is not sponsored in any way, but I do have one Olipop every day for that reason, because it's just like a nice, easy way to get, I think it's like 9 grams of fiber or something in just, a 12-ounce can.
That's probably only like 8% of your
I
daily
understand
fiber.
that, but I'm just saying, like, it's the easiest way for me, because I also have RFID. I don't know if you're familiar, Paul, but that makes it tricky to get, all the fruits and veggies. So that's what I do. Also smoothies. Like when I do, fruits and veggies are easier as a smoothie than they are as like raw fruit or veggie.
100%. And I'm about to maybe change everything for you.
Ooh.
What about chia seeds?
Oh.
Can you do the texture of chia seeds?
I could try
Have you
again.
tried? Have you tried?
Yeah.
You've tried
Because you put them in smoothies. Like,
okay.
Blend it all up.
Yeah. But that's a high. That's big bang for your buck.
It is the biggest superfood hack that I regularly do now. 3 tablespoons of chia seeds, which is a serving, 2 to 3 tablespoons, has roughly 6 to 9 grams of protein, 9 to 10 grams of fiber, which is a third of your daily requirement there. It has 6 grams or so of alpha linolenic acid, so omega-3s. I mean, this is all in 3 tablespoons, and these numbers might be off. I'm sorry. They're off the top of my head. But you can add them to your Olipop, or you can throw them in your smoothie. I like the texture. I'm a big boba tea drinker, and I kind of think about it like natural boba when I put it in a drink.
Okay. Yeah.
There you go. Your bowel movements will be shot out of a cannon. Just clean as a whistle.
There you go. I don't know. I gotta try it again. I've had them like baked into food, but maybe adding it to a smoothie or a beverage instead would be a better, more successful option for me.
So, Paul, tell us about elementary school. Like, so your website, elementarySchool.com, you're working on it. Like, what's going on? What's coming up for you in 2026?
I'm so excited for this year. This is the year that I really try to put community first. So much so that we're planning on visiting my community around the country of medical students, residents, trainees, fellows, PA students, trying to encourage and support people in person. And I've gotten to meet a lot of medical students and residents just in talks that I give, but I'm excited to give some commencement speeches this year and be able to just visit people in person, shake their hand, and say, "You're seen. You are important. You matter. What you're doing today matters." Gosh, that's all I've ever wanted out of social media. I got on social media to connect with these people who I'm working alongside with every day, but now I get to have a bigger impact on it. And that's the most exciting thing possible. And I'm trying to say the tagline, in the age of AI, I want AI to stand for authentic interaction. So that's the exciting thing I'm building up towards this year.
That's fantastic. Have you Have you given a commencement address before? Will this be the kind of the first year you're diving into that?
I gave a commencement speech in a white coat speech at a PA school in December,
okay.
which was really cool in Atlanta, South College. But I'll be I may be following in your footsteps, maybe at some programs that I'm going, some schools that have
That's
invited me
great.
this year.
Yeah, I've always said that the commencements are by far my favorite speaking engagements that I do, and I usually only do like one a year at most, and mainly because I can only come up with so many things to be like inspirational about, like, and
Yeah, he's mostly angry.
before I
so.
start repeating myself, and and so but the energy, the excitement of like being just with these brand new physicians who are just they
They're so happy.
they're just so excited to like begin their careers, and in no way have they been beaten down by the healthcare system yet. And what I have the ability to do, and what you have the ability to do, is give them the tools and the wisdom to be able to kind of have success, but also protect themselves, right? And to be able to stay true to who they are. And so it's just such a unique opportunity to be able to do stuff like that. So I'm so happy for you.
Oh, thank you so much.
What's coming up with content? Are you trying new stuff out? Are you gonna branch out into different specialties? And I don't know, you got some.
Will your med students ever graduate?
Yeah. Yeah, you could do a whole. No, that's a good point. You could do like a whole series with your med student character, like it becomes a resident, and then hijinks ensue.
I certainly could, and I think that's the cool thing is, um, someone even commented the whiplash between seeing you as a student and now the attending is crazy, because I've done a couple of
Yeah.
videos recently where I was the attending and the POV behind the camera is shadowing me. Um,
Oh
and
yeah.
I learned from this brand expert named Caleb Ralston. Really cool. He built up some creators like Gary Vanderchuck um and Alex and Layla Hormozy. But he says there's a 70-20-10% rule to content, where 70%, like the majority of the things you do, like if I fall into that, those are my med student skits. 20% is kind of you're tweaking certain things. That might be where I start doing more attending content, like the person working with the attending or some of the healthcare. And then 10% is just off the wall. That's the lab. That's just trying different things. I mean, those different things. That's my series, like dinosaur versus muscle name or medical term. I've always loved doing those kind of trivia, fun. I mean, they're completely fun and non-hazing, non OR style Socratic method,
Yeah.
if you will. So
Yeah. No, that's
yeah,
good.
I'm
Well,
always open to try new stuff.
keep up. Please keep making content. I love seeing content creators who are still practicing. Still, I mean, I mean, you're even
Yeah,
more
he's
impressive because
putting you to shame.
you're teaching,
Yeah.
you're educating,
Multiple schools.
yeah. So I'm just so impressed. Please keep it up. We need good role models for this type of thing. That's really important. And eventually, you and I will start a fellowship of
Social media content.
social media comedy in medicine, and you'll get a fake diploma, and it won't mean anything, and people will love it.
I am so down. Let's do it. Starting tomorrow.
All right.
It's okay. I'm on service, but
Yeah.
it's okay. Someone
That's
else
right.
can cover.
Paul, again, the website is elementaryschool.com, and people can find you on TikTok, is all over social media. Paul Tran, thank you so much for joining us.
Thank you so much for having me.
Did we tell all of our constipation stories?
I mean, no. I think there's many to draw from. However, for the sake of our relationship with our children, maybe we
And our
just
viewers
keep
and
those.
our listeners.
And yes, people might be eating lunch or breakfast, you know?
I think it's fine. I mean, we all know what happens to food eventually. But you
don't want to think about it while you're eating it.
Well, anyway, if you are currently thinking about it and have a story to share, or you want to let us know what you think about gastroenterology, you can let us know. Email us, knockknockhi@human-content.com. You can also hang out with us in the Human Content Podcast family over on Instagram and TikTok @Human Content Pods. Thanks to all the listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube @GlockenFleckens, I'll give you a shout out. Like we have Andrew Spoyer 7183 said, maybe folks are reading less research articles because they keep getting more expensive. Yeah, paywalls are
Yep, that's
big
a thing.
deal.
Mm-hmm.
That's why whenever I started the New England Journal of Medicine thing,
Making videos out of those articles.
I was like, if you're gonna want me to make videos about research, like you got to make them open access.
Yep.
And they did, and that's worked out really well.
Kudos to them.
Yeah. So I really appreciate that from the New England Journal of Medicine. But I agree. Let's get less paywalls on research. I mean, it feels icky.
It does, especially in an age when information is so readily available.
Right. It seems old-fashioned. That's the thing.
All it's doing is creating a barrier to accurate evidence-based information. Well, everything else just roams free.
And most of the publishers out there, especially the big for-profit ones, their profit margins are like 40%. They can handle it.
I think they're all right.
All right. Let's see. YouTube. We have full video episodes drop every week on our YouTube channel. Again, that's @GlockenFleckens. We also have a Patreon, fun perks, bonus episodes, early ad-free episode access, interactive Q&A live stream events, patreon.com/GlockenFlecken. Or go to glockenflecken.com to learn more. Patreon community perks. Let's shout out the Jonathans, shall we? Lucia C., Edward K., Marion W., Mr. Granddaddy, Caitlin C., Brianna L., MP Cole, Tracy B., Mary H., Keith G., Parker, Muhammad L., David H., Kaylee A., Gabe, Gary M., Eric B., Marlene S., Scott M., Kelsey M., Dr. Hoover, Sean M., Ryan N., Jess K., Hawkeye MD, Belby Salt, Shiny D. Patreon roulette time. Random shout out to someone on the emergency medicine tier. Shout out to Reese M. Reese, thank you for being a patron. And thank you all for listening. We're your hosts, Will and Krista Flannery, the GlockenFleckens. Our executive producers are Will Flannery, Krista Flannery, Aaron Courtney, Rob Goldman, and Shanti Brick. Our editor and engineer is Jason Portizo. Our music is by Omer Bensvi. Knock Knock Guys, program disclaimer and ethics policy. Oh, if you want to learn about Knock Knock Guys, program disclaimer and ethics policy, submission verification and licensing terms, and HIPAA release terms. That's right, a podcast has an ethics policy. If we can have an ethics policy for a podcast, you can have one for your hospital, for your residency program. Let's get some ethics. Let's get some social media ethics policies going here, folks. Give people a path to success on social media. That's all we're saying.
That's right.
Go to glockenflecken.com. Reach out to us at knockknockhi @human-content. Am I saying that right? knockknockhi @human-content.com with questions, concerns, or fun medical puns. Knock Knock Hi is a human content production.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.